Hi, my name is Tenmadi Vasu. My matrix number is 08DEU23F1197. Today, I'm going to present the first question of our case study, nervous system. A. Resting potential and how an action potential is generated. A resting potential is the stable electrical charge difference across a cell membrane when a neuron is not actively sending signals, primarily maintained by a balance of ions like sodium and potassium. With more potassium inside the cell and more sodium outside, Na plus channels and K plus channels are closed, resulting in a negative charge inside, compared to the outside of plasma membrane is positively charged, an action triggered by a stimulus that reaches the threshold, causing the Na plus channels and K plus channels to open, allowing a depolarization to the cell, generating inward movement of Na plus, makes inside of the membrane more positive, followed by a repolarization phase where K plus channels are open and Na plus channels to restore the resting potential through ion movement out of the cell. Na plus movement into the cell stops and K plus channels movement out of the cell increase. Action potential is an explosion of an electrical activity that is created by the depolarizing current. When it's simulated, protein channels in the membrane open and let the sodium into the cell, making the membrane potential more positive. A stimulus causes the resting potential to move toward 0 MV. When the depolarization reaches about negative 55 MV, it will fire an action potential. This is the threshold. Next, repolarization sodium happens when a channel is closed and potassium K plus channels are open, letting K plus ions out, restoring the negative charge inside the cell. Hyperpolarization happens and the membrane temporarily closed becomes more negative than the resting potential as the K plus channels are closed slowly. At last, it returns to the resting state where the neurons return to its resting potential, ready for another action potential. B. Common disorders, diseases, and injuries related to the nervous system. Alzheimer disease. Alzheimer disease is the most common form of dementia among older people. The causes of Alzheimer disease are unknown to the medical professionals. They believe that family history, age, particular genes, protein deposits in the brain that are abnormal, environmental aspects, issues with the immune system could be the causes. Alzheimer patients experience mood and behavioral issues that it make difficult for their family members to take care of them. Second, Parkinson disease. It is a degenerative disorder of the central nervous system. When the brain nerve cell produce insufficient amount of dopamine, a neurotransmitter that influences mood and movement, Parkinson's disease results. But common symptoms include tremors, muscle stiffness, slowness of movement, and changes in posture. Symptoms are movement related. These include shaking, rigidity, slowness of movement, and difficulty with walking. Parkinson disease usually occurs around age of 65 years, but some people can be diagnosed when they are younger than 45 years. Transient ischemic attack TIA. A TIA is a brief occurrence of stroke-like symptoms. It is brought on by a momentary obstruction of blood supply to the brain. A transient ischemic attack TIA often lasts only few minutes and does not result in permanent harm. In addition to slurred speech or difficulty comprehending others, symptoms might include sudden weakness, numbness, or paralysis in the face, arm, or leg, usually one side of the body, double vision or blindness in one or both eyes, dizziness or loss of balance or coordination. Subarachnoid hemorrhage (SAH) is bleeding in the space below one of the thin layers that cover and protect your brain. A ruptured brain aneurysm or head trauma are the most common causes of SAH. Between your skull and the tissue of your brain are three membrane layers and coverings, known as the meninges. When there is a bleeding under the arachnoid layer, SAH occurs. Their severity can vary. An excruciatingly painful headache can strike suddenly, like a clap of a thunder, is the primary symptom of SAH. Acute spinal cord injury (SCI). Numerous bones called as vertebrae make up your spine. Traumatic injuries that cause the spinal cord to be bruised, partially torn, or fully torn are known as acute spinal cord injury (SCI). SCI is a prevalent cause of death and a long-term disability in both adults and children. Following a spinal cord injury, your spine can be in shock. This results in a loss of reduction of reflexes, muscle action, and feelings. C. Related diagnosis technologies or equipments. Cerebral angiography. Cerebral angiography is a procedure that only uses special dye, contrast material, and X-rays to see how blood flows through the brain. The radiology center hospital performs the cerebral angiography. Throughout the test, an electrocardiogram (ECG) tracks the activity of your heart. Your arms and legs will be covered in sticky patches known as leads. The leads and the ECG equipment are connected by the wires. This test performed if you show any following symptoms or indicators: brain artery narrowing, vasculitis, or inflammation of the brain blood arteries. Computed tomography (CT or CAT). A CT scan is a non-invasive diagnostic imaging technique that creates horizontal or axial images, commonly referred to as slices, of the brain using certain X-ray measurements. Compared to ordinary head X-rays, brain CT scans can offer more detailed information about the brain's tissue and structures, offering additional information regarding brain disorders and injuries. When the other forms of examination, like X-rays or physical examination, are not conclusive, a CT scan of brain may be used to check tumors or other lesions, injuries, intracranial bleeding, structural abnormalities like hydrocephalus, infections, brain function, or other conditions. Neurosonography, known as brain sonography, neurosonology, or neuroimaging, uses specialized beam shapes, high frequency sound waves from a transcranial Doppler to create diagnostic image of the brain, spinal cord, and other components of the central nervous system. Neurosonography is a specialized sector of medical imaging that operates to detect or prevent anomalies and diseases in the brain, helping to optimize patient outcomes with targeted courses of action. Being portable, it can be performed at the bedside, especially for a very sick neonates in the neonatal intensive care unit or patients on the extracorporeal membrane oxygenation (ECMO), who cannot be transferred to the radiology department for CT or MRI scan.
My name is Narmada and my matrix number is 08DEU23F1142. Functions of endocrine system by using the sketch diagram. And this is the sketch diagram. The endocrine system consists of glands that produce a secret hormones regulating various bodily processes and maintaining homeostasis. Hormones are chemical messengers that travel through the bloodstream to target cells, influencing growth, metabolism, reproduction, mood, and more. Glands like pituitary, thyroid, adrenal, and pancreas control crucial functions such as growth, metabolism, stress response, and blood sugar regulation. The endocrine system coordinates complex interactions between organs and systems, ensure proper development and functioning. It plays a role in maintaining the body's internal balance and respond to external factors contributing to overall health and stability. These are the common disorders, diseases, and injuries related to endocrine system. Diabetes. Diabetes is a condition where the body cannot regulate the blood sugar due to insufficient insulin. Common types of include type 1 and type 2. Symptoms are thirst and frequent urination, hunger and weight changes, tingling in hands or feet, fatigue, and blurry vision. Hyperthyroidism. When the thyroid produces too many hormones, often due to conditions like Graves' disease. Symptoms are fast and irregular heartbeat, sleep issues and nervousness, neck swelling. Hypothyroidism. The thyroid doesn't produce enough hormones, causing the body to slow down. Symptoms are fatigue and cold sensitivity, slow heartbeat and dry skin, weight gain and muscle cramps. Cushing syndrome cause too many cortisol affecting stress response and metabolism. The symptoms are weight gain in the face, upper body, weakness, fatigue and easy breathing, decreased sex drive. Polycystic ovary syndrome. Polycystic ovary syndrome. Hormonal imbalance affecting the ovaries. Symptoms are irregular periods, excessive hair growth, acne and weight gain, dark patches of skin. Related diagnosis technologies or equipment. Ultrasound, commonly used for visualizing the thyroid gland and detecting nodules and enlargement. Magnetic resonance imaging, which is MRI, help to visualize pituitary and adrenal glands for tumors or abnormalities. And the final one is computed tomography, CT scan, used for detecting adrenal tumors and other gland abnormalities.
Third question, blood. A. Function and characteristic of blood cell. Erythrocytes or red blood cells are responsible for the characteristic color of blood. The primary job of the red blood cells is to transport oxygen from the lungs to every part of our body. Additionally, red blood cells can return the waste products like carbon dioxide to our lungs for exhalation. The protein hemoglobin allows red blood cells to carry oxygen. Leukocytes or white blood cells. The primary role of white blood cells is to aid in the fight against infections. White blood cells are extracted from transfusible blood since the majority of white blood cells are unique to our bodies. White blood cells come in five primary varieties, which are lymphocytes, monocytes, eosinophils, basophils, and neutrophils. The last one, thrombocytes, often known as platelets. They are formed from a bone marrow, the spongy core of our bones. The primary job of a platelet is to quickly reach a blood cell injury and create a plug to repair the damage. This plug, often called as a thrombus or clot, aids in halting blood loss. Related diagnosis technologies or equipment. Sphygmomanometers. Sphygmomanometers, sometimes known as blood pressure cuffs, are devices that measure blood pressure. They are employed to gauge the blood pressure in the heart, arteries, and other parts of the patient's circular system. Although there are many different kinds of sphygmomanometers, they all function similarly. An oscillometric sphygmomanometer, which resembles a stethoscope, measures arterial pulse waves coming from the blood flow while a cuff is inflated and put around the patient's arm to increase the pressure on the blood cells. Hematology analysis. The hematology test, the most basic blood test, looks at the quantity and the shape of bloods to determine the body's general health. Many hospitals and health examinations often do this test. In the past, lab personnel used microscopes to manually count blood cells. Sysmex had led the way in the blood testing innovation for more than 50 years, collaborating closely with the healthcare experts to create novel testing techniques that boost clinical laboratory efficiency and promote more cutting-edge medical treatment.
Hi, my name is Nur Farafisha Ashila binti Ismadi. My matrix number 08DEU23F1136. So the cardiovascular system. I will explain to you how the blood through the heart. First, the blood that has delivered oxygen to the body returns to the heart through through the two large veins. So number one is the super vena cava from the upper body and the inferior vena cava from the lower body. So next, blood enters the right atrium where it's temporarily stored. When the right atrium construct, blood flows through the tricuspid valve into the right ventricle. So the right ventricle constrict and pumps blood through the pulmonary valve into the pulmonary arteries. So the pulmonary arteries carry the blood to the lungs where it's release carbon dioxide and pick up oxygen. So now oxygenated blood returns to the heart via the pulmonary veins into the left atrium. Blood enters in the left atrium. Blood enters, and then when the left atrium construct, blood flows through the mitral valve into the left ventricles, and then the left ventricles, which has a thick muscular wall, construct and pumps blood through the aortic into the aorta. So the aorta distributes oxygenated blood to the rest of the body. Now we go to the cardiovascular disorders. Number one is hypertension. Hypertension is like a high blood pressure. It is causes by genetic and family history, maybe from the age, risk, increase, lifestyle, maybe poor diet, and then the lack of exercise, like that's all, and obesity. So symptoms, maybe you can get headache, shortness of breath, noticeable dizziness, and blurred visions. And then the treatments you can do is a lifestyle change by dieting and exercise. So for medication that can provide you is diuretic, ACE inhibitors, calciums, and channel blockers. Next, we go to heart failure. So the symptoms is shortness of breath, fatigue, and swelling in the leg or ankles. There's because of the heart's inability to pump blood effectively and leading to the fluid build-up and insufficient blood supply to the organs. So the treatments, medication that can give you is a diuretics, ACE inhibitors, beta blockers. You also can do the lifestyle changes. The device can use in medication is implantable cardiovascular defibrillator, pacemaker, and heart transplant in severe cases. So next, number 3 is coronary artery diseases, CAD. The symptoms we can get is a coronary artery disease, hypertension, heart valve disease, cardiomyopathy, arrhythms, and other factors like diabetes, obesity, and certain infection can also contribute. So the treatment that we can do is a lifestyle change, diet, or exercise. For medication, they can give you statins, beta blockers, angioplasty, stent placement, coronary artery bypass grafting, CABG. This is number 4 is peripheral artery diseases, PAD. By narrowing of peripheral arteries, usually in the legs, reducing blood flow. Is causes by smoking, diabetes, high cholesterol, and atherosclerosis. The symptoms: your leg pain during inactivities, numbness, and ones that do not heal. The treatments that we do is a lifestyle change, and for the medication, they can give you antiplatelets and surgical interventions. So now we go to diagnostic technology. I give you 3 examples. First is electrodiagram ECG, ECG. ECG is a diagnostic test that records the electrical activity of the heart over a period of time. It provides valuable information about the heart's rhythms, rate, and overall electrical functions, and helping to identify various cardiac conditions. So next is a echocardiogram. Echocardiogram is a non-invasive imaging test that uses sound wave to create a visual image of the heart's structure and function. So it is provide crucial information about the heart size, shape, and motion, as well as the function of the cameras and valves. So next is ABI. ABI is ankle brachial index. Is a simple non-invasive test used to assess peripheral artery disease (PAD) and measure the blood flow in the arteries of the leg compared to the arm. It helps evaluate the presence of severity of artery blockage.
Respiratory system. Mechanism of inhalation and exhalation of respiration. Inhalation. External intercostal muscle contract. The internal intercostal muscle contract and relax. The rib cage is pulled upwards and outwards. The diaphragm muscle contract. The diaphragm moves downwards and flattens. Thoracic volume increase. Air pressure in the lungs decreases to below atmospheric pressure. Air is drawn into the lungs. So, the volume of the lung increases, the lungs are expanded. Exhalation. Internal intercostal muscle contract. The internal intercostal muscle contract and relax. The rib cage is pulled downward and inwards. The diaphragm muscle relaxes, the diaphragm moves upwards and curves. Thoracic volume decreases, air pressure in the lungs increases and becomes higher than atmospheric pressure. Air is exhaled out the lungs. Volume of the lungs are decreases, so the lungs return to its original volume. These are the common disorders and diseases related to the respiratory system. First is asthma, chronic condition causing airway inflammation, leading to difficulty breathing, wheezing, and coughing. The second one is tuberculosis, which is called TB, bacterial infection that mainly affect the lungs, causing persistent cough, weight loss, and fevers. The third one is cystic fibrosis, genetic disorder leading to thick mucus buildup in the lungs and other organs, causing frequent lung infection. And the last one is bronchitis, inflammation of the bronchial tubes, causing cough and mucus production, often due to infection or smoking.
Question 6. Digestive system. A. Digestion process from mouth until anus. The mouth. Salivary glands located in front of the ears, under the tongue, and near the lower jaw. Second, pharynx and larynx. Third, esophagus, the muscular tube. Fourth, stomach. Acidic environment is for destroying toxins, food such as bacteria. Enzyme pepsin breaks down proteins into peptides. 5. The small intestine. The small intestine is where many nutrients like protein, carbohydrates, and fats get absorbed. 6. The large intestine, where the excess water is absorbed from the food. 7. Rectum, where the feces are stored. And 8. Anus, the opening where the feces leaves your body. B. Chemical digestion along the gastrointestinal tract. The saliva combines with the food when it's being chewed, softening and breaking it down. Additionally, saliva lubricates food particles, making swallowing them easier. A bolus is created when a food and saliva combine. After chewing, the person consumes this. Saliva, which is produced by the salivary glands, contains the following compounds that aid in the chemical breakdown of food, such as water, mucus, the lingual lipase and amylase enzymes, which aid in the breakdown of fats and carbohydrates, sodium, potassium, calcium, bicarbonate. Three pairs of big salivary glands can be found in person's mouth at the following locations: the parotid glands beneath and in front of the ears, glands beneath the jaw that are submandibular, glands beneath the tongue called sublinguals. There are hundreds of tiny salivary glands in the mouth as well. C. Related diagnosis technologies or equipment. Endoscopic retrograde cholangiopancreatography (ECRP). A technique called ERSP uses X-rays and upper gastrointestinal (GI) endoscopy to identify and treat issues with the pancreatic and bile ducts. When your pancreatic or bile ducts are leaking, narrowing, or clogged due to gallstones that grow into your gallbladder, doctors do ERCP. On X-rays, the dye will increase the duct's visibility. The physician examines the ducts using fluoroscopy, a form of X-ray imaging, to check blockages or narrowed sections. A colonoscopy. An examination known as colonoscopy is to perform to check abnormalities in the rectum or large intestines, colon, such as cancer, polyps, or swollen irritating tissues. A long flexible tube called as colonoscope is placed into the rectum during colonoscopy. The doctor can see the entire colon inside thanks to a tiny video camera at the tube's tip. During colonoscopy, the scope can be used to remove polyps or other abnormal tissue if needed. Additionally, a colonoscopy may involve the collection of tissue samples or biopsies. Endoscope. An endoscopy is a procedure used to look closely at internal body structures. An endoscopy involves a medical professional inserting an endoscope, a long thin tube, into your body until it reaches the organ or area they want to examine. At the end of the most endoscope is a light and a unique camera. Images or videos organs of other body parts are captured by the scope. It shows them on a screen that is visible to your provider. Special channels can be found inside several endoscopes. During endoscopy, healthcare professionals can perform surgery or implant devices to remove tissue.
Urinary system have four parts. Uh, Number one is kidney, ureterus, uh, bladder, and urethra. And as I will focusing about the kidney. The kidney filter blood to form urine. They are responsible for the process of filtration, reabsorption, secretion, and accession. So in the kidney, we have a nephrons. The nephrons is the primary function occurs in the glomerulus, where blood plasma is filtered to form a fluid called a filtrate. So this is a process of filtration in urine formation. In glomerular filtration, blood enters the kidney through the renal artery and reaches the glomerulus, a network of capillaries surrounded by the Bowman's capsule. So high blood pressure in the glomerulus force water, electrolytes, glucose, amino acid, and waste product out of the blood and into the Bowman capsule, forming the glomerular filtrates. So, this is a related diagnosis technology or equipment that medical use it. First is urinalysis. Urinalysis is a laboratory analysis of urine to assess kidney function, detect metabolic disorder, and identify infections. So medication use the physical examination to by knowing from the color and clarity, as in chemical test, knowing by pH, protein, glucose, ketones, and microscopic examination by knowing from the cell and crystals. Next is the ultrasound. Ultrasound is an imaging technique that uses sound waves to visualize the kidneys and urinary tracts. And then it helps to detect abnormalities such as cysts, stones, and tumors.
These are the male reproductive hormones. Testosterone develops secondary sexual characteristics, supports sperm production, and influences libido. Luteinizing hormone stimulates Leydig cells in the testes to produce testosterone. Follicle stimulating hormone, which is called FSH, stimulates sperm production in the testes by supporting the Sertoli cells. The role of placenta during pregnancy: supplying oxygen and nutrition, transfer essentials from mother to fetus, removing waste, eliminates fetal waste production, producing hormones, release hormones HCG, estrogen, progesterone to maintain pregnancy, and the last one is providing immune protection, which is act as a barrier to infections, transferring antibodies. Related diagnosis technologies and equipment. Spirometry measure lung function, especially airflow and lung capacity. Chest X-ray visualize lung structures, detect infections, fluid or tumors. Plus oximetry measure blood oxygen levels non-invasively.